Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today's topic is about diffuse hair shedding. Its name, Telogen Effluvium. You've never heard that before, but I'm sure you know someone or yourself who've had the distress of having your hair fall out. Understanding what triggers this condition and how to manage it can make a real difference in recovery and peace of mind. Joining me today is Dr. Bryn Henderson, a board-certified physician, leader in regenerative medicine. Dr. Henderson, thank you for being here because more people than you know are losing their hair. I have in a day maybe 5 people that come in and say, can you refer me to derm? I'm losing my hair.
Well, it's a privilege to be here, and now we'll start at the basics and you will learn.
All right. What is it?
Telogen effluvium, or TE, it's a lot less difficult to say than effluvium, is a form of diffuse, non-scarring, that's a big deal, hair loss. It happens when a large number of hair follicles abruptly shift from the growing phase, called anagen, into the resting phase, which is telogen. That leads to increased shedding and typically noticed 2 to 3 months after a triggering event. So the common triggers include surgery, childbirth, major illness, crashes, dieting, iron deficiency, even thyroid imbalance, or, in a big one, emotional stress is huge.
Is TE a genetic condition?
No. TE doesn't of itself have a direct genetic cause. It's what we call a reactive alopecia. Big word means you're losing your hair because of a response to stressors. However, in people with genetic predisposition to androgenic alopecia, which is male or female pattern hair loss, TE unmask or accelerate the appearance of that condition. So genetics may play an indirect role.
Are there any embryologic factors to consider?
Not directly. TE is an acquired condition that typically arises in adulthood. And the hair follicle does develop with the ectoderm in the embryo, but unlike congenital hair disorders, TE does not have a structural abnormality. The follicles are intact. They've just been pushed into a dormant phase due to internal or external stress.
What about Chinese medicine? What do they do for it?
Well, they wisely realize that this is a reflection of a harmony issue. So they reflect on your internal harmony, especially related to blood, liver, and kidney. A telogen effluvium is often seen as a result of blood deficiency, the kidney yin depletion, or liver qi stagnation. For instance, postpartum hair loss might be explained by loss of yin or blood during childbirth. Treatments include acupuncture and herbal formulas, which nourish blood and calm the liver and can be used in addition to medical treatments.
Well, how is TE diagnosed in your office?
The diagnosis is clinical each time. We take a good history, especially through the events of the last 3 months that are prior to the shedding now. And a hair pull test can be done. That's sort of easy. All you do is grab a few hairs and pull it out and see how much you get. And if it's positive result, then you use what they call a trichoscopy. A trichoscopy, trick meaning hair, oscopy meaning microscope. So trichoscopy is done in a lab so they can rule out other causes like thyroid disorders, iron deficiency, or vitamin D deficiency. In rare cases, a scalp biopsy can confirm increased telogen to anagen ratio, but most of the time that diagnosis is clear from the clinical picture to be related to stress of some kind.
All right, so what are the standard of care now?
Well, the most important step is to identify correcting the underlying trigger. Nutritional deficiencies have to be improved, hormone imbalances have to be corrected, and you've got to address the stress. For support, we may use iron and vitamin supplements, Minoxidil, which is a topical to speed regrowth of the hair in persistent cases. Spironolactone, which is an oral medicine that helps with the growth of hair in androgenic alopecia. Psychological support, especially if stress or anxiety, is contributing, and it nearly always is. The telogen effluvium is typically self-limiting, especially in acute cases. Recovery begins in 2 to 4 months and may take 6 to 12 months to resolve for your whole hair restoration.
Well, you're an expert in regenerative therapy. What do you do for loss of hair?
We're very fortunate. We can use platelet-rich plasma, which is perhaps the most studied. It delivers both growth factors, healing factors, and it helps promote vascularization. In other words, it grows new blood vessels. So PRP has shown benefits even post-COVID TE and chronic TE, and improving hair density in those that are having increased shedding. The mesotherapy of days of old involves injecting vitamin minerals and amino acids, which are proteins, into the scalp. And that enhances microcirculation as well and supports follicular health. Regenerative therapies, especially adipose-derived and mesenchymal cells, are being explored for their ability to restore the follicular environment and reduce inflammation.
What lifestyles would you suggest to your patients?
Well, lifestyle matters a lot. Here are the pillars. Nutrition is first. Correct the balance, the iron, the zinc, the vitamin D, and protein intake. Avoid the crash dieting. And probably the biggest in the world is sleep. Get your 7 to 9 hours of quality sleep, and it really supports the hair cycle. Scalp care, good one, is use gentle shampoo. Avoid heat. And all the tight hairstyles, oh my gosh, they're very detrimental to this particular TE. Stress management, of course, mindfulness and yoga reduce stress. Please avoid toxins. Cut back on smoking and alcohol in environmental areas. And the lab monitoring is often helpful to track progress. Follow the ferritin, vitamin D, zinc, and TSH levels.
What's the long-term outlook for someone who's losing their hair with TE?
In most cases, the prognosis is excellent. Once the trigger is removed, the hair regrows, and it takes time, but there's visible recovery, usually within 2 to 3 months, and it may take 6 to 12 in total, but it's coming back. So chronic telogen effluvium, lasting longer than 6 months, may require treatment and evaluation in a different area. But proper care and patient education, most people see full or near full regrowth in 6 months. Patient reassurance is key. TE is not scarring, it's not permanent, and recovery is possible.
Well, what's your mnemonic for it?
Loss.
L stands for?
Look for the triggers, the illness, the surgery, the childbirth, the crash dieting. Emotional stress is the most common.
O?
Onset is delayed. Hair shedding starts in 2 to 3 months after the stressor.
S?
Self-limiting. Most cases resolve in 6 to 12 months.
S?
Support with care. Address nutrition, hormones, and reduce stress.
So, thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.